Hi, I'm Dr. Ann Peters, the Director of the Clinical Diabetes Programs at the University of Southern California in Los Angeles. I'm here today to talk to you about the safe use of insulin pumps. I take care of lots of patients with type 1 diabetes, and many of those patients are on insulin pumps. I find insulin pumps an incredibly helpful technology when I try to control blood sugar levels. They're very useful in terms of helping patients calculate insulin doses, carbohydrate count. The adjustable basal rates, I think, are very useful in mimicking normal glucose physiology. So I'm a big fan of using insulin pumps. But insulin pumps aren't for everyone, and I often get patients referred to me who want to go on a pump but don't really understand what's involved. And issues about insulin pumps really came home to me when I read recently an article in the May issue of the Journal of Pediatrics, which basically was a report from the FDA showing that over the past 10 years in adolescent patients on insulin pumps, there were reports of both death and injury in those individuals. Now, adolescents are a particularly difficult group of patients to treat, especially with type 1 diabetes, and whether they're on shots or on insulin pumps, there's no real magic to treating these patients. But just like any other patient, whether they're older or younger, I think insulin pumps need to be used sensibly. So first of all, if a patient's blood sugars are way out of control, their A1Cs are above 9 or 10, they're not testing, and they're really not adhering with what they need to do to take care of their diabetes at all, that's not a pump candidate in my mind. To be on an insulin pump, patients need to be at least testing 4 times a day, if not more often, and they need to do this throughout the time they're on the pump. And the reason this is so important is there's no depot insulin. Patients on insulin pumps are just getting a little trickle of rapid-acting insulin that's going in all day long, but if there's a clog or an occlusion, they can end up without adequate insulin delivery and their blood sugar levels can quickly rise. So patients not only must test 4 times a day every time they come to see me, and pump patients need to come in at least every 3 months, I download their meters and their pumps to be sure that they're actually doing what they say they're doing, that they're testing frequently enough and using the pump appropriately. Patients need to be taught how to troubleshoot the pump. They need to be taught how and when to give injections in case the pump isn't working. They need to test or know when to test urine ketones, and then they need to know when to call for help. I think if these principles are reinforced, if patients are seen often enough, if these safety measures are in place, patients can use the pump really well. They can get great blood sugar control. But if they're not using the pump in these ways, if they're not testing often enough, then they can go back to insulin injections and use those safely until such time as they appear to be ready to use the insulin pump again. So I think these technologies are helpful, but I think it's very important to keep in mind their risks and to reinforce these safety measures at every visit. Thank you for listening. I'm Dr. Ann Peters.